So, good day everyone. So, we're gonna talk all about artificial family planning method. So, our method is calendar rhythm method.
The calendar or rhythm method is a natural family planning method that helps a woman identify her fertile and infertile days by tracking her menstrual cycle. This method works by recording the length of several past cycles and using that information to predict when ovulation is likely to happen. Since a woman is most fertile a few days before, during, and shortly after ovulation, the method helps her know when she should avoid unprotected sex if she wants to prevent pregnancy. It doesn't use any medicine or device. It's purely based on understanding the body's natural cycle. However, it requires regular tracking and discipline to make sure the predictions are accurate.
The advantage and disadvantage of this method. Advantage. Number one, no cost, completely free. You don't need to buy pills, condoms, or visit a clinic. You only rely on tracking your menstrual cycle. No hormones or medical procedures. Since it's natural, you avoid hormonal side effects such as weight changes and mood swings or nausea. Number 3. Has no side effect. Unlike hormonal conservative, there are no physical reaction from using this method. Number 4. Helps increase body awareness and understanding of fertility. You'll learn how your menstrual cycle works, such as fertile and infertile days, which improves body awareness. 5. Accept by religious groups that prefer natural methods. Some religions encourage natural family planning over artificial conservative. This method aligns with those beliefs. The disadvantage. Number 1. Less effective than many modern conservative because it based on estimation and biological pattern. There is higher chance of miscalculating fertile days. Number 2. Not suitable for women and irregular cycle. If your cycle length changes frequently, it becomes very difficult to predict fertile days accurately. Number 3. Requires consistent and accurate record keeping. You must track your cycle every month, usually for several months to get accurate data. Number 4. Illness, stress, and lifestyle change can affect the cycle. Factors like stress, sickness, lack of sleep, and the changes of routine can shift ovulating. No protection against STIs. This method does not protect against sexually or transmitted infection. You will need condoms or STI protection. 6. Requires cooperation and discipline from both partners. Both partners must agree to avoid intercourse or use backup protection during fertile days. This requires communication, patience, and self-control.
When it comes to effectiveness, the calendar method is about 76% effective when used correctly. This means that out of 100 women using the method for a year, around 24 might still get pregnant, especially if their cycle is irregular. In terms of cost, this method is basically free because it doesn't require any medication, tools, or devices. A woman only needs a calendar or a tracking app. For availability, it can be used anytime and anywhere since it relies completely on personal monitoring. No clinic visit is required, which makes it accessible to anyone. However, it's, it still needs consistency and accurate recording keeping.
The calendar method, also known as the rhythm method, is a natural family planning technique where a woman tracks her menstrual cycles over several months to estimate when she is most likely to be fertile or infertile by identifying her safe and unsafe days. Partner can decide when to have avoid intercourse depending on whether they want to prevent or achieve pregnancy. One key strength of this method is that it promotes body awareness. Women became more familiar with their cycle patterns, hormonal changes, and signs of fertility. This awareness often leads to better communication between partners, since must participate actively discussion cycle days, agreeing on abstinence and or protecting during fertile periods and supporting each other in accurately tracking the method.